community counseling services in Wicklow receive over €20,000 funding. Imagine the profound impact when vital mental health support becomes more accessible to children and families right in their own communities. This is exactly what's happening in Wicklow, where over €23,000 in funding is set to enhance community counseling services, ensuring timely and essential help reaches those who need it most. But here's where it gets controversial. How do we ensure these funds are used most effectively? And are community services truly equipped to meet the growing demand? 3 dedicated community and voluntary organizations in Wicklow have been awarded financial support to expand their counseling and therapeutic programs. This investment aims to provide a broad spectrum of mental health services, including psychotherapy, play therapy, creative arts therapy, bereavement support, and systemic family therapy. These interventions are crucial for children and young people, offering them a safe space to heal and grow. Edward Timmins, the Fine Gael TD for Wicklow, expressed his enthusiasm about the funding, emphasizing its importance in delivering these services locally. He highlighted that this funding will significantly improve access to counseling for young people across the county, helping families navigate difficult times with professional support close to home. Timmins specifically mentioned 3 organizations benefiting from this funding: Sophia Counselling Center in Kiltegan, County Wicklow Community Partnership, and Greystones Family Resource Center. The financial breakdown is as follows. Sophia Counselling Center in Kiltegan will receive €8,500. County Wicklow Community Partnership is allocated €10,000. Greystones Family Resource Center will get €5,000. Deputy Timmins also pointed out a key development in how these services are funded nationally. Previously, the money came from the Dormant Accounts Fund, but now it has been integrated into the budget of TUSLA, the Child and Family Agency. This shift means a more stable and predictable funding stream for 73 community and voluntary organizations across Ireland, which collectively receive €1.5 million annually to provide these essential mental health services. And this is the part most people miss. While the funding is a positive step, the real challenge lies in ensuring these services can keep pace with increasing demand, and that the quality of care remains high. Are community organizations prepared for this responsibility? How will they measure success and adapt to evolving needs? For those interested in more local news from Wicklow, East Coast FM offers a variety of updates. Ronan Dunn, known as the Human Rocket, is making a comeback from injury to defend his title at the Red Bull Hardline event in Wales. A local TD has welcomed the appointment of a new Garda detective in Arklow, following a recent surge in violent incidents, signaling increased Garda support in the area. Wicklow councillors are working closely with County Gael officials and clubs to promote climate action and sustainability, encouraging local sports organizations to join the environmental effort. A planning application to build 650 new homes in Fassaro was rejected by Ancoy Michiun Plainala, halting a major development project north of Bray. A new film shot in Wicklow celebrates the remarkable contributions of a Tina Healy-based farmer and his dairy farms to Ireland's culinary and beverage heritage, with a premiere scheduled in South Wicklow next week. What do you think about this funding boost for community counseling? Is it enough to meet the mental health needs of Wicklow's youth, or should more be done? And how do you feel about the shift in funding responsibility to TUSLA? Does this guarantee better service delivery, or could it introduce new challenges? Share your thoughts and join the conversation below. $112,500 boost for Mayo Family Counselling Services, mental health support in Ireland. In a significant move to strengthen community support networks, 4 organizations in County Mayo will be granted a total of €112,500 to enhance their counselling services aimed at families and children. This announcement was made by Minister of State Alan Dillon, who expressed the positive impact that these funds are expected to have on local communities. This substantial amount will facilitate essential counseling and therapeutic services that are crucial for many families in Mayo, Minister Dillon enthusiastically noted, "I'm thrilled to witness this funding being allocated, which will bolster community-oriented counseling, psychotherapy, and diverse therapeutic practices like play therapy, creative arts therapy, bereavement support, and systemic family therapy across Ireland." The organizations that will benefit from this funding include the following: the Ballina Family Resource Centre, receiving €8,500, the Family Centre in Castlebar, which is awarded €66,750, the Knock Counselling Centre, granted €32,250, and the Westport Family Resource Centre, which will receive €5,000. Dillon emphasized the importance of these funds in providing timely access to critical counseling services for children and young people within their local environments. He stated, "These services are indispensable to countless families in our community, and I'm especially pleased to see the funding allocated to the Family Centre in Castlebar, which offers outstanding support services." Nationally, there is a budget of €1.5 million designated annually for 73 community and voluntary organizations that provide similar essential services. It's particularly noteworthy that this funding has now been formalized. Previously, it was sourced from the Dormant Accounts Fund, but it will now be provided from the budget of TUSLA, the Child and Family Agency. Minister Dillon, representing the Fine Gael party, acknowledged the tireless effort and commitment of those managing the local community counseling services. He also expressed satisfaction that the Knock Counselling Centre will receive the crucial funding it rightly deserves. As these developments unfold, it's vital to consider, is this funding enough to meet the growing mental health needs in communities? Or could there be more efforts to streamline and increase the support? Share your thoughts in the comments